There is a saying that if you're not on the table, you're on the menu. It means that if you're not involved in the control of your fate, someone else will. My name is Abdul Majid Abid, and I'm a surgical pathology fellow at the University of Pittsburgh Medical Center. I have been involved with organized medicine for the last 5 years and have held positions in leadership in some of them. And I would be talking to you about organized medicine today. This talk is intended for medical students interested in pathology and junior residents. I'll start by I'll start by answering the question that many of you would have in your mind. Why should I join a professional society? There are many reasons why you should join, and it depends on what motivates you. Are you interested in representing your program or your specialty? Are you interested in policy making? Do you want to gain access to educational resources provided by these organizations? You have to answer these questions for yourself. Another important aspect is when you go into practice, there is no one who is going to protect your interests at the state and the national level. That is where organizations come in. Do you know how many physicians in the US are practicing pathologists? That is an important number to know. Lastly, being active in organized medicine teaches you skills that you don't learn in your residency program. Let's take a look at some organizations that I suggest that you join. Residents and medical students can join CAP and ASCP free of cost. USCAP or USCAP is for residents only. Some state pathology societies also offer membership to medical students, so you have to do it on a case to case basis. The CAP is the largest organization in the US representing board certified pathologists. They have a political action committee or PAC that works with members of Congress in DC to advocate on behalf of pathologists. They are also involved in setting reimbursement for CPT codes within the AMA. That is how pathologists get paid. The Residence Forum Executive Committee or RFEC is an excellent leadership training opportunity. Engaged Leadership Academy or ELA. It happens in November or December every year, and it is a wonderful resource to learn public speaking and how to deal with media. Pathology Leadership Summit, which was previously known as Hill Day, happens every year, usually early May, where pathologists visit their representatives in Congress and talk to them about issues affecting the specialty. This is an overview of the CAP as they see themselves. These are the statistics that the CAP has about itself. You can find more information about the Engaged Leadership Academy at this link. The Residence Forum is a place where all residency programs in the US and Canada are represented. Every program appoints delegates to the forum who have voting rights for the executive committee elections. There are 2 cycles of Leadership Development Award that the CAP Foundation gives. The first one is awarded to attend the spring meeting or to attend the Pathologist Hill Day, the Pathology Leadership Summit. The second one is awarded to either travel to the fall meeting or to attend the Engaged Leadership Academy. I should mention that at the CAP annual meeting, residents and medical students have the opportunity to do mock interviews with practicing pathologists in anticipation of either a fellowship interview or a residency interview or a job interview. And they can also get their CVs reviewed by professional trained CAP librarians. To join the CAP, you can scan these QR codes. ASCP is the largest organization representing laboratory professionals, including pathologists and pathology residents. They administer the RISE exams, they offer grants for away rotations, and they have a free mentorship program for members. At their annual meeting, there are board reviews specifically tailored for residents, and they also have other professional development opportunities. Many programs in the US buy educational modules from the ASCP, and they can be found under the Education tab on the ASCP website. To join, for residents and medical students, you can scan this QR code. USCAP or USCAP focuses on academic pathology. Their annual meeting is a wonderful time to showcase your research, attend the fellowship fair, and network with academic pathologists. To join USCAP as a resident, you can scan this code. Here is a brief list of leadership positions available to residents in different organizations. And some of them I have not mentioned before, like the ACGME or the American Board of Pathology, but these are also positions that can be availed by residents. Here are some of the perks of the position. If you are a CAP delegate or an RFEC member or a CAP committee member, or if you get elected to the ASCP Resident Council. And obviously, the other positions also have their perks, but these are some highlights. For medical students, these leadership positions are available both at your medical school level and at a national level. All of these organizations have different scholarships and awards available for residents, as mentioned here. And you can obviously, once you join, you can look into more details of each of these awards. The same is true for medical students. If you have an abstract accepted at USCAP related to a particular subspecialty, you can apply for awards from the society representing that specialty. This is a screenshot of the award from a hepatopathology society, and there are other societies that do the same. If you have something in cytopathology or GI pathology or pulmonary pathology, you can also apply for awards for that. This is from a GI pathology society. This is a screenshot of that. These are some of the study resources that are available if you join these organizations. I did not mention the Digital Pathology Association earlier, but they have some amazing high yield cases. Same for Path Presenter, and I actually benefited a lot from these high yield cases while I was studying for boards. So these are highly recommended, and they are free to join, and I think this is a great return on investment. If you want to enhance your leadership skills, here are some of the resources. Some of these are free and some of them cost money. This is a calendar of annual conferences and deadlines for abstracts for those conferences throughout the year. I have not included state society meetings here, but I highly recommend keeping an eye on them. My advice usually is to aim for at least one local and one national meeting per year. You can do as many as you like, but you should invest your time wisely and not go to conferences without a clear agenda. You should either be presenting a research, or you should be aiming for going to either the fellowship fair or network with a particular set of pathologists that you think may be helpful in your fellowship or your job. Finally, a brief overview of my own involvement in organized medicine. I started off as a liaison from my residency program to the Texas Society of Pathologists. I eventually was appointed as a chair of one of TSP's committees. In my second year of residency, I was elected to the CAP Residence Forum Executive Committee and was accepted to the ELA. In my third year, I was re-elected to the RFEC. I joined the CAP committee, and I presented at one of the Residence Forum meetings. In my fourth year, I was nominated to the Board of Trustees of Texas Medical Association. In summation, there are many benefits to joining professional societies. For medical students, it helps during your residency applications. If you go to meetings, you can network with residents and program directors. You can get scholarships and awards. For residents, there are opportunities to enhance your skills. You can advocate for your specialties. You can find fellowships, you can find mentors, you can publish research, and even find future employers. So it's a win-win. And you don't have to join all of these. You can pick and choose. It's up to you, but do what you feel is the best for you. Thank you and best of luck.